CDC warns the use of antibody tests for giving inaccurate COVID-19 results. The antibody tests used to determine if people have been infected in the past with COVID-19 might be wrong up to half the time, the U.S. Centers for Disease Control and Prevention said in new guidance posted on its website. Before that issue announced by the CDC, several issues regarding the use of antibody test kits occurred in different countries. Nearly 2 million antibody tests imported into Australia and costing $20 million were declared unusable. Another 80% of test kits for COVID-19 blood antibody that the Czech Republic purchased from China gave wrong results. Slovakia purchased 1.2 million antibody-based test kits from China which were found to be inaccurate. But China accused the Czech Republic and Slovakia of incorrect use of antibody-based tests, after Slovakian Prime Minister said the kits should be dumped into the Danube. Moreover, Ateş Kara of the Turkish Health Ministry said the antibody-based test kits Turkey purchased from China had a high error rate and did not put them into use. Also, the UK purchased 3.5 million antibody test kits from China but in early April 2020 announced these were not usable. On the 21st of April 2020, the Indian Council of Medical Research (ICMR) has advised Indian states to stop using the rapid antibody test kits purchased from China after receiving complaints from one state. Rajasthan Health Minister Raghu Sharma on the 21st of April said the kits gave only 5.4% accurate results against the expectation of 90% accuracy. The Chinese embassy in India described the decision to oust Chinese test kits to be unfair and irresponsible and look at issues with preemptive prejudice when responding to ICMR's decision, and explained that antibody tests are only for surveillance purposes. Several countries have provided evidences about the inaccurate and unusable antibody test kits purchased from China. Antibody tests, often called serologic tests, look for evidence of an immune response to infection. Antibodies in some persons can be detected within the first week of illness onset, the CDC says. They are not accurate enough to use to make important policy decisions, the CDC said. Serologic test results should not be used to make decisions about grouping persons residing in or being admitted to congregate settings, such as schools, dormitories, or correctional facilities, the CDC says. Serologic test results should not be used to make decisions about returning persons to the workplace. Health officials or health care providers who are using antibody tests need to use the most accurate test they can find and might need to test people twice, the CDC said in the new guidance. In most of the country, including areas that have been heavily impacted, the prevalence of SARS-CoV-2 antibody is expected to be low, ranging from less than 5% to 25%, so that testing at this point might result in relatively more false positive results and fewer false negative results, the CDC said. It's a point that's been made frequently in recent weeks by public health experts, but the CDC spells out the problem in the new advice on antibody testing. According to an interview from Dr. Thomas Jean, a senior health advisor with the Oregon Health Authority, said the test could lead to 50% or more false positives. If you take the test now and you get a positive result, it may be no better than a coin flip in terms of whether that is a true positive or a false positive, said Dr. Jean. He said there are some tests done in hospital or commercial labs that are closer to 99% accurate, however, they are not as widely available. Even if you are confirmed to have coronavirus antibodies in your system, Dr. Jean said, we still don't know how much immunity, if any at all, a person has or how long it would last. Part of the problem with antibody tests when it comes to COVID-19 is the relative low prevalence of disease. The shortage of cases in some areas makes it hard to draw any conclusions. Antibody test kits may also lead someone to false positive to believe they have been infected when in fact they have not been. It cannot be assumed that individuals with truly positive antibody test results are protected from future infection, the CDC says in the updated guidelines. Serologic testing should not be used to determine immune status in individuals until the presence, durability, and duration of immunity is established. The new CDC guidelines echo advice from groups such as the University of Minnesota, which cautions against using antibody tests to make policy decisions. The CDC explains why testing can be wrong so often. A lot has to do with how common the virus is in the population being tested. For example, in a population where the prevalence is 5%, a test with 90% sensitivity and 95% specificity will yield a positive predictive value of 49%. In other words, less than half of those testing positive will truly have antibodies, the CDC said. Alternatively, the same test in a population with an antibody prevalence exceeding 52% will yield a positive predictive greater than 95%, meaning that less than 1 in 20 people testing positive will have a false positive test result. Therefore, it's best to use tests with high specificity, which are unlikely to throw up a lot of false positives, and in populations where doctors suspect there are many cases, the CDC said. The Food and Drug Administration has also warned on their website about the accuracy of antibody tests.